Sciatica affects millions of people around the globe, and there are several factors, such as sedentary lifestyle, obesity, lack of exercise and aging population, that might contribute to the perception that sciatica is more common these days. Symptoms of sciatica can range from minor nuisance to debilitating problems. Before diving into sciatica and its management, it is crucial to understand the human vertebrae and spinal nerves which form the sciatic nerve. Please watch the video till the end to have a better understanding of sciatica. The human spine is made up of 33 vertebrae, which can be divided into 5 regions. Cervical, 7 vertebrae in the neck. Thoracic, 12 vertebrae in the upper and mid-back. Lumbar, 5 vertebrae in the lower back. Sacral, 5 fused vertebrae forming the sacrum. And coccygeal, for fused vertebrae forming the coccyx or tailbone. Each vertebra has several key features, including vertebral body, the thick, disc-shaped anterior portion of the vertebra that supports the weight of the body. Intervertebral discs, cushion-like structures located between adjacent vertebral bodies, acting as shock absorbers, and allowing movement between the vertebrae. Vertebral arch, a bony arch that forms a protective ring around the spinal cord. Spinous process, a bony projection from the back of the vertebra, which can be felt as the ridge down the back. Transverse processes, 2 lateral projections from the vertebra, providing attachment points for muscles and ligaments. Spinal canal, the hollow space within the vertebral arch, through which the spinal cord passes. Spinal nerves emerge from the spinal cord and exit the spine through openings between adjacent vertebrae called intervertebral foramina. These spinal nerves carry sensory information from the body to the spinal cord via dorsal roots, and motor commands from the spinal cord to the muscles and glands via ventral roots. There are 31 pairs of spinal nerves, each classified based on the region of the spine from which they originate. These nerves play a crucial role in transmitting signals between the central nervous system and the rest of the body, enabling movement, sensation, and various bodily functions. The intervertebral disc consists of 3 main components. Annulus fibrosus, which is a tough outer layer composed of fibrous cartilage, providing stability and structure to the disc. Nucleus pulposus, it is a gel-like inner core made of water, collagen fibers, and proteoglycans, acting as a shock absorber and distributing pressure within the disc. Cartilaginous end plates, these are thin layers of cartilage above and below the disc, attaching it to adjacent vertebral bodies and facilitating nutrient exchange. These components allow the intervertebral disc to provide flexibility, support, and cushioning to the spine. If you like the content, please consider liking, sharing, and subscribing. What is sciatic nerve? Sciatic nerve is actually a bundle of nerves that come from 5 nerve roots. L4, L5, S1, S2, and S3, branching off from the spinal cord. Sciatic nerve is the longest and thickest nerve in the human body. It's up to 2 centimeters wide, a UK 1 penny coin is about the same width. The human body has 2 sciatic nerves, one on each side of the body. Each sciatic nerve runs through the hip and buttock on one side. They each go down the leg on their side of the body until they reach just below the back of the knee. Once there, they split into 2 other nerves, the tibial nerve and common peroneal nerve. What is sciatica? Sciatica, also called lumbar radiculopathy, is a set of symptoms caused by compression of one of the nerve roots that make up the sciatic nerve as they exit the spine, usually the last lumbar nerve root L5, which causes weakness in the foot, or the first sacral nerve root S1, which causes severe pain along the back of the thigh. Sciatica is caused by different conditions. The most common conditions are slipped or herniated disc, degenerative disc disease, spinal stenosis, spondylolisthesis, and piriformis syndrome. Slipped or herniated disc. It is a rupture in the annulus fibrosus of the vertebral disc, which allow the soft nucleus of the disc to bulge outside. This bulge can harmfully affect the nerve root. Degenerative disc disease. This happens with age. When your spinal discs and the cushions wear away, the bones can start to rub together. This contact can cause pain and other problems, including sciatica. Spinal stenosis. Spinal stenosis is a common condition where the small spinal canal, which contains the nerve roots and spinal cord, becomes compressed. Spondylolisthesis. Spondylolisthesis is a displacement of a vertebra, in which the bone slides out of its proper position onto the bone below it. Piriformis syndrome. Piriformis syndrome occurs when the piriformis muscle compresses the sciatic nerve and results in inflammation. If you like the content, please consider liking, sharing, and subscribing. Symptoms of sciatica. Sciatica pain can vary widely. You may experience lower back pain, leg pain, that often feels worse than the back pain. A change in sensations, such as pins and needles, numbness, hot or cold, burning sensations, shooting sensations, or sensations that can be hard to describe in the leg or foot. The pain most often occurs on one side. Some people have sharp pain in one part of the leg or hip and numbness in other parts. The pain or numbness may also be felt on the back of the calf or on the sole of the foot. The affected leg may feel weak. Sometimes, your foot gets caught on the ground when walking. The pain may start slowly. It may get worse after standing or sitting for a long time. During certain times of the day, such as at night. When sneezing, coughing, or laughing, especially if caused by a herniated disc. When bending backward or walking more than a few meters, especially if caused by spinal stenosis. And when holding your breath or straining, such as during a bowel movement. If you like the content, please consider liking, sharing, and subscribing. Red flag symptoms of sciatica. While sciatica can often be treated with non-invasive measures, it is important to watch for red flags. If you ever experience any of the following symptoms, that may indicate a more serious underlying condition. So, it is important to seek medical attention right away to prevent your condition from becoming worse and/or chronic. If you like the content, please consider liking, sharing, and subscribing. Management of sciatica. Managing sciatica involves reducing pain and improving mobility. You can try self-treatment for mild cases. Use ice packs, wrapped in a towel for 20 minutes, several times a day, during the first 1 to 2 days. Afterwards, switch to a heating pad for 20 minutes at a time for 2 more days. If you're still in pain, switch between hot and cold packs, whichever best relieves your discomfort. You can also use over-the-counter NSAIDs to reduce pain, swelling, and inflammation. No bed rest for more than 24 hours. However, if the pain is moderate to severe with numbness, tingling, or muscle weakness, please seek professional medical care and avoid self-treatment. Try the 9 following targeted sciatica exercises to reduce acute sciatic nerve pain, improve leg mobility and range of motion, promote soft tissue healing, improve sciatic nerve function, provide muscle and soft tissue conditioning, and prevent, or at least minimize, recurrence of pain. Pelvic tilt. Lie on your back, with your knees bent and feet flat on the ground. Pull your belly button in towards your spine. Hold this position for 20 seconds, then relax. Aim to complete 10 repetitions of this exercise. Straight leg raise. Lie on your back, with your knees bent and feet flat on the ground. Pull your belly button in towards your spine. Straighten one leg out and gently raise it 6 to 8 inches of the ground. Hold for 2 to 5 seconds and lower it back. Aim to complete 10 repetitions of this exercise on each side. Back flexion. Lie on your back, with your knees bent and feet flat on the ground. Pull your knees to your chest until you feel a comfortable stretch across your lower back. Hold the stretch for 30 seconds, then slowly lower your legs back. Aim to complete 10 repetitions of this exercise. Hook lying march. Lie on your back, with your knees bent and feet flat on the ground. Press your lower back into the floor, by tightening your stomach muscles. Slowly alternate raising, 1 foot at a time, an inch or 2, off the ground. Continue marching this way for 30 seconds. Aim to complete 2 to 3 repetitions of this exercise on each side. Bridge. Lie on your back, with your knees bent, and feet flat on the ground. Slowly raise your buttocks, 6 to 8 inches, off the ground. Hold this bridge position, for 8 to 10 seconds, then slowly lower your buttocks, back to the starting position. Aim to complete 2 sets of 10 repetitions of this exercise. Abdominal curl up. Fold your arm across your chest. Lift your head and shoulders, towards the ceiling. Hold this position for 2 to 4 seconds, and then, slowly lower your upper body. Aim to complete 2 sets of 10 repetitions of this exercise. Press up. Lie on your stomach. Slowly prop your upper body onto your hands. Hold this position for 5 seconds, working up to 30 seconds. Aim to complete 10 repetitions of this exercise. Prone leg raise. Lie on your stomach, with your forehead resting on your hands. Pull your belly up towards your spine, and keep your legs straight out. Slowly alternate raising one leg at a time, about an inch or 2 off the ground. Aim to complete 10 repetitions of this exercise on each side. Buttocks stretch. Begin on all fours. Extend one leg behind, making sure to keep the pelvis straight. Gently move your hips towards the floor and lean forward. Hold this stretch for 30 seconds. Aim to complete 3 repetitions on each side. Safety considerations. Because sciatica can be caused by different conditions, not all exercises work the same for everyone. Don't push yourself to do exercises that don't feel right. Find ones that suit you. As you get better, you might do exercises that didn't work initially. But it's more important to stick to your routine than make it harder. If you have other health problems, talk to your doctor before trying these exercises. If your pain gets worse after exercising, see your doctor right away. If you like the content, please consider liking, sharing, and subscribing.